WFYI podcasts are brought to you by Visit Bloomington. With over 350 restaurants to choose from, Bloomington, Indiana is truly a food lover's paradise. Go to visitbloomington.com to discover what suits your taste.
This is WFYI News Now. It's February 15th, and I'm Abriana Herron. On today's show, free bike share rides during NBA All-Star Weekend, a play celebrating a pivotal event in Indianapolis Black history, and preventative screenings like colonoscopies are supposed to be free for patients. But a regulatory loophole leaves some patients on the hook for hundreds of dollars or more.
It does worry me a little bit for the future. My husband is due for a colonoscopy, and because of this, he doesn't want to get one done.
Those stories coming up. But first, despite an increase in home buying in Marion County, racial inequalities in homeownership persists. As Ben Thorpe reports, that's according to a new report released yesterday by the Fair Housing Center of Central Indiana.
The report looks at new housing data from 2021 to 2022 and includes home ownership and mortgage lending trends in Indianapolis. It expands on a previous report with data from 2018 through 2020. Amy Nelson is the executive director of the Fair Housing Center of Central Indiana.
And overall, what we found was continued inequities and disparities, primarily against people of color, in being able to access mortgages or being able to be approved for mortgages.
Those disparities were particularly stark for mortgage denial rates. White and Asian applications saw denial rates that were close to half of the denial rates for Black applicants. The report shows some improvements, including home ownership increases across racial groups. Nelson says more data will be needed to see if those trends continue. I'm Ben Thorpe.
The Pacers Bikeshare program will offer free rides during NBA All-Star Weekend. Riders can access a free 30-minute ride with use of a promo code in the mobile app or at any Pacers Bikeshare station. Credit card information will still need to be provided, and usage fees will apply to any ride over 30 minutes. There are 50 bike share stations around the city, most of which are along the Indianapolis Cultural Trail. The free rides will be offered Thursday, February 15th through Sunday, February 18th. And a play celebrating a pivotal event in Indianapolis Black history is this weekend to coincide with festivities for the NBA All-Star Weekend. Sydney Dauphiné has more on the production called A Touch of Glory.
The play is about the Crispus Attucks High School boys basketball team of 1955. They were the first all-black boys basketball team in the country to win a state high school basketball championship. Terrence Asante Doyle is the production manager for A Touch of Glory. He says the production is meant for Indianapolis community members and those visiting the city for the All-Stars.
We always want, though, for audiences to come away with something, whether it be inspired to research more or inspired to have ongoing conversations about whatever subject matter that we're dealing with.
Asante Doyle says the production is a way to share important history in a way that's also entertaining. The event is free, but registration is required on the Indianapolis Public Schools website. I'm Sydney Dauphiné.
And for our final story today, if you're between 45 and 75, your doctor probably tells you you need to get a colonoscopy every decade. This routine screening slashes the risk of dying from colorectal cancer by more than 80%. And in most cases, it should not cost you a dime. But some patients find themselves slammed with large bills that can haunt them for years. Farah Usuri looks at how that happens through one woman's story.
I met Karen Campbell over coffee. She is a very early riser. She had just turned 46 and is pretty health conscious. So when her doctor said she's due for a colonoscopy, she booked an appointment.
And I'm lying, in the bed, and they're like counting down from 10. Next thing you know, you're knocked out, you wake up, and you're like, oh, wow, that's it?
Campbell's colonoscopy at Eskenazi Health in Indianapolis went perfectly. The doctor said everything was clear. She thought the most uncomfortable part was over.
And a few months later, I get a bill from the hospital.
Campbell is in a Blue Cross Blue Shield of Texas private insurance plan through her employer. The hospital billed her insurance, and the insurance left Campbell on the hook for around $800. She knew that doesn't make sense because the Affordable Care Act says patients should not pay anything for preventative screenings like mammograms and colonoscopies.
We want to encourage people to take advantage of evidence-based preventive services to detect diseases like cancer early.
That's Anna Howard with the American Cancer Society's Action Network.
One way that you want to encourage people to take advantage of preventive services is you want to remove as many barriers as possible.
But barriers are all that Campbell's been facing since she had the colonoscopy. She spent a year and a half fighting this medical bill. It's become part of Campbell's morning routine to drink her coffee and make calls like this one to the hospital's patient advocacy department.
She said, "I'm currently out of the office. Please do not leave a message because it won't be returned in a timely manner."
It's been a lot of finger pointing between the hospital and the insurance company. She shows me her hospital bill. It has one big charge that insurance did not cover in full. It's for a recovery room where staff kept an eye on her breathing and heart as she woke up from anesthesia. The hospital told me they bill for that every time with a screening colonoscopy, and insurance pays it. It's the first time they run into an issue. Here's where it gets dicey. According to federal law, it's the responsibility of the insurance company, not the healthcare provider, to guarantee that preventative care is totally free for the patient. This loophole gives hospitals like Eskenazi a chance to tack on some charges and let insurance decide whether to cover the costs or pass it on to the patient. Here's Sabrina Corlett with the Center for Health Insurance Reform at Georgetown University.
Unless either the state or the federal regulator explicitly says, you cannot do this very specific thing, the plans or the providers will try to get away with the maximum they can get away with. And unfortunately, the patient is caught in the middle.
It's like a game of whack-a-mole, Corlett says. If it's not a recovery room expense, it could be a charge for, say, surgical trays. Karen Campbell stood her ground.
No, I have not paid the bill, so they sent the bill to collections.
Debt collectors would call and text her every day. That's when she reached out to me. Less than 48 hours after I contacted the hospital about Campbell's case, a director there called her.
On your account, I did put in a formal request for an appeal.
A week later, poof, her balance was zero. Insurance covered it all. Blue Cross Blue Shield told Campbell that they had a processing error in the claim and they finally fixed it. They declined to discuss Campbell's case with me even after I sent them a written authorization from her.
It does worry me a little bit for the future. My husband is due for a colonoscopy, and because of this, he doesn't want to get one done.
Now, doctors and advocates advise people to dispute medical charges if they think there is a problem, but more importantly, to never put off preventative care for fear of medical bills. They say prevention can save you a ton of money and potentially terrible health problems like a cancer diagnosis that comes too late. I'm Farah Yusri, Side Effects Public Media.
If you've struggled with medical bills that you think are inaccurate, reach out to our journalists at WFYI and Side Effects Public Media. The healthcare system doesn't always work with everyone, and we cover those stories. That's all for today's episode of WFYI News Now. Our podcast is produced by the following people who live in your community: Darian Benson, Daudelin, Kendall Antron, who composed the music for this podcast, and me, Abriana Herron. Our news director is Sarah Neal-Estes. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.